Hi, my name is Amelia Lindberg. I'm the founder of Body Fluent Physical Therapy, where my mission is to help women and those who identify as women live healthier and more active lives. When COVID-19 started, I decided to make a series of videos to help the general public to learn how to expand their lung capacity, to breathe more deeply, and to maintain their overall lung health. At the time of my first two videos, COVID-19 was thought to be a respiratory virus. However, we now know that it's more of an inflammatory virus. This is the third video in a series of 3 videos. And in this video, I'm going to be teaching you some simple techniques for chest physical therapy. This video is not meant as a substitution for evaluation and treatment. Please consult your doctor before trying this, especially if you have a history of blood clotting or if you have any history of lung compromise. The 3 things that I'm going to demonstrate today are: first, percussion; second, vibration; and third, a quick stretch technique. So let's get started. Okay, first I'm going to demonstrate chest percussion. So we've got to identify where the lungs are. The lungs are from the top of the shoulder down to the base of the rib cage. So about right here. If you get any lower, you'll be percussing on the kidneys, and that's not a good idea. So you want to stay along the rib cage, and you're going to cup your hand as though you're holding water. And then you're going to rhythmically pat the back. Now you're not smacking the back. Imagine you're doing this on a little baby. In fact, less is more. And it's better to err on the side of gentleness. One great way to practice this technique that I learned from a colleague of mine years ago is on your thigh. So cup your hands and practice it on your own thigh. You want to get that good, like, clip clap sound going. So I'm going to start here. You can go all around the rib cage. And then I would also come around to the other side and do the opposite side. I find that I get better leverage reaching across to percuss than if I'm percussing on the same side. Another way to do this right now, if you remember from the other videos, we talked about how lungs are very dependent on gravity. So the top of the lungs will get the most air, the bottom of the lungs will get the most blood. So depending on how you position your lungs in space, top part's getting the air, bottom part's getting the blood. So if I have the person roll onto their side, if you can roll onto your side, please. This part of the lungs is getting more air. This part of the lungs is getting more blood. So again, if I do my percussion while the person is inside lying, I get good access actually to both sides of the body. So there's that side, and if I wanted to, I could also do the other side. The next technique I want to show you is vibration. Again, imagine you're working with a little baby. We're not jamming onto the person. We're using gentle hands, less is more. But with vibration, you're just going to follow the person's natural breathing. So I've got this person here is taking a deep breath in and then exhaling. And you can kind of see that the rib cage is rising and falling. So as they take a deep breath in, I'm just following their natural breathing pattern. Nothing forced. And although I am encouraging them to take deep breaths. So on the exhale, I'm going to start to shake my hands and follow their rib cage as they exhale. When they inhale, I relax. As they exhale, that's when the vibration occurs. Inhale, my hands relax. Exhale, vibration. Inhale. The third technique I want to show you is called the quick stretch technique. And what this does is it allows for a greater expansion of the rib cage. What you're doing is you're utilizing a quick pressure to the rib cage to facilitate a reaction by the muscles of the rib cage to relax and fully expand even further. So, as the person takes a deep breath in, you're going to do your regular vibration as they exhale. And at the base of their exhale, you provide a little pressure inward and then follow their rib cage. Relax and let the rib cage expand. Vibrate as they exhale, bottom of their exhale, little stretch inward, and then relax your hands to allow the rib cage to fully expand. Exhale, vibrate downward, tiny stretch in, and then let the rib cage fully expand. Tiny stretch, and allow the rib cage to expand. So again, if you can imagine the person's rib cage is in my hands, I'm going to vibrate down while they exhale. At the base of the exhale, I'm giving a little quick stretch in. Do you see, like a little tiny push in, and then let their lungs expand naturally. Okay, so those are the three techniques. I like to do them on both sides. So I'd have the person roll over to the other side and I'd perform them on the other side. I recommend for percussion doing about 5 minutes on a side with the vibrations. I recommend doing 5 cycles of vibration with the inhales, 5 deep breaths on each side. And then if you'd like to, you can just incorporate the quick stretch as I showed you with the vibration. I hope you enjoyed this video. Check out my website for more free tips and tricks on how to know your body better. www.bodyfluentpt.com. Bye for now.